Hi guys, welcome back to Let's Learn with Nurse Grace. So if you're new to this channel or you've just come across this channel, welcome. Welcome to my channel. My name is Grace Hezekiah and I'm a registered nurse. In this channel, we talk about everything and anything to do about sexual reproduction. So if you're very interested to know more about your sexual reproduction, please make sure that you subscribe to this YouTube channel so that we can grow and you can get to learn more about your sexual reproduction. Thank you so much for those who have already subscribed. And if you haven't subscribed, please make sure that you subscribe to this YouTube channel. Thank you so much, and let's get to the video. So guys, today I'll be letting you know about sex pills. So I've got people asking about sex pills. I just talked about on my Instagram and asked and there are those people who asked about some sex pills and what they need to know more about sex pills. I need to talk about sex pills. So what are these sex pills? What are the best sex pills that you can use for? What are these side effects about these sex pills that people use? So today I'm here to answer your question about sex pills. If you're very interested to know more about sex pills, please make sure that you watch this video until the end. So sex pills are designed to help people who have sexual problems. For example, those people who have premature ejaculation problems. For example, those people who are not able to achieve an ejaculation. They're not able to make their penis harder or something like that. So these sex pills are designed for them. So if you know you're that person who has no issues, you don't have any issues of ejaculation, of making your penis become harder during sexual intercourse, if you know you don't have any of these issues, please make sure that you really avoid taking these sexual pills. In fact, you shouldn't take, because why are you taking them? Why are you taking them? You shouldn't take these pills if you don't have any issues with your sexual reproduction. These pills are specifically designed for these people. And these pills are usually, in most cases, they're usually prescribed by your doctor or by your pharmacist. I'm saying the pharmacist because they're those people who fear going to the doctors and trying to explain that, oh, doctor, I have this problem. Oh, doctor, I have this problem. There's no way I can ejaculate when I'm with my partner. There's no way I can get harder or something like that. So there are those people who are very shy of talking about these things. The good thing is that we've got these online things, online sites that have got this registered pharmacists that can help you make the right decision, make the right choice on these sex pills. And they can prescribe for you and you can have it. In these instances, they can keep monitoring you, because when you're taking these pills, it is very important for your doctor to keep monitoring, to do your blood test, to do everything in order to make sure that everything in your body is perfect. So we've got a lot of different kinds of pills. For example, we've got Viagra. I know Viagra is the commonest thing that a lot of people know. We've got Viagra, we've got Cialis. So I'll just be talking about these two because they're the most common pills that a lot of people use them. So these pills take approximately about 20 weeks. For example, Cialis takes approximately about 20 minutes before it starts to take effect within your body. So it's usually advisable for you to take at least a half an hour before the sexual intercourse, and it usually lasts up to about even 36 hours. And if you're taking pills like Viagra, before it takes effect, it usually takes about 1 hour. So within 1 hour, then it can be effective in your body, and it can stay with your body within up to 4 hours, or in some instances it can take up to 12 hours, and for the Cialis can take up to 36 hours. So what are the best pills for you? So I wouldn't tell you go and buy Viagra, go and buy Cialis. What I would advise you is that your doctor is in the best place to advise you on what kind of pills is very suitable for you to take. And in most instances, this doctor, it might take a few trials for you to take. You might start with maybe Viagra, you go to Cialis, you go to another kind of pill, and it might take a lot of trials before you get to know which of these among of these pills is the most effective. So it takes a lot of time, and it might take. There are those people who might just take instantly, and it might work for them. And there are those people who have to try this, try the other one, try the other one before they actually get to know which is the best pills among those that have taken. So your doctor is in the very, very best place to advise you on what kind of pill you're supposed to take. And before they do that, you have to undergo some testing, some maybe pictures and everything in order for the doctors to identify exactly what is the cause of you not maybe achieving, maybe having premature ejaculation. What is the cause of you maybe not becoming hard during any sexual intercourse? So the doctor is in the very, very best place to give you the best advice. So are these pills safe? So these pills, depending on whatever reason you're taking, if it's taken for the right cause, if it's prescribed by the doctor or the pharmacist, then these pills are safe. If they're prescribed by the doctor and they're taken for the right cause. I'm just saying that because you find people who don't have any issues with their sexual reproduction just going to the pharmacy and they're just saying, just like lying, they're not able to do this and that because they want it to be maybe faster, to be longer, because maybe they paid for it or something like that. Then they want it to be longer or maybe faster. So they might go ahead and lie. So in that case, it's not safe for you because you have lied and you're not taking it for the right reason. If you're taking it for the right reason, it's been prescribed for you to take it and you are being monitored in the course of the medication, then it's very, very safe for you to take it. Do these pills increase sex drive? In most cases, pills like Viagra don't increase sex drive. These pills, they're only taken in order for you to achieve and maintain an erection. So in instances that you need to boost your sex drive, you need to consider natural foods, like foods that are very, very rich in vitamins, like maybe oranges. Consider fruits like avocados. You can also consider supplements like taking niacin, and you can do exercising. You can do take a lot of water, and basically do a lot of things, just the natural things that can help with your sex drive. Maybe sleep earlier, make sure you sleep for a little bit longer, like make sure that you achieve the best time of sleep. And with these natural things, they're going to be helping you out on your sex drive. It is usually encouraged for you to visit a doctor in order for you to ascertain what is the cause of you not having sex drive, because there might be causes like hormonal imbalances. Maybe there are some vitamins or some nutrients or some minerals that are not enough in your body that might be making you to not have enough sex drive. So it is usually recommended for you to see your doctor, and they're going to be doing some tests, and they're going to be advising you on what to take. But in all the other cases, please make sure that you try the natural, maybe foods and exercising, sleeping better, avoiding stress, and you can try to see that with time they might help out with your sex drive. So what are the common side effects of these sex pills? One of the side effects we've got the headaches, we've got visual problems, we've got other things like they might affect with your gastrointestinal disorders. For example, you might experience indigestion, you might experience vomiting, you might experience dizziness, you might also have flashes, and these flashes might be increased, or they might get severe in such cases where you take alcohol with these pills, or in such cases where you stand for a long period or you sit for a long period in outside, like maybe outside or inside, with places that have very, very high temperatures. They might also affect, and that they might cause you to have these flashes. So the uncommon side effects that we've got, one of them is priapism. Priapism is basically an erection that takes more than 4 hours. And when you have an erection that will take more than 4 hours, it's going to not be fun. It's not going to be fun. It's going to be very, very painful, because you can't imagine yourself having 4-hour erection. It's so painful. It's so tiresome to your body, to your brain, and to your mind. It's very difficult. So those are one of the uncommon side effects. And in such cases that you experience these uncommon side effects, like you might even have your vision lost, and you might even experience like hearing loss, or maybe your hearing might start to be impaired. So in such cases that you experience these uncommon side effects, it's very, very advisable for you to stop taking this pill immediately and visit your healthcare provider. They're going to be advising you. They might see an alternative if they can change to another suitable pill, or if they can stop you and start you on other form of treatments that may help you to regain your erection back. So generally, these pills that you take increase the level of nitric oxide in your body. And this nitric oxide, they're sort of dilators. They help your blood vessels to dilate, like to expand in size. And when they do that, then we're going to have enough blood supplies, enough blood supply. So if the blood vessels are a bit wider and the blood volume is passing on very well, and these pills specifically do this function within our penis. And if it does that, then if you get to find that you're going to be achieving and maintaining a very, very good erection. So if you know you've got no issues with achieving your erection and maintaining your erection, you've got no issues with maybe things like erectile dysfunction, you've got no premature ejaculation, then I will really strongly advise you against using these pills, because you might be using it, and after all, a long effect of it, it might be leading to whatever. You might be you might be lying that you've got these issues for you to take this medication, and in the long time, you might actually have these issues coming to you. So it's very, very advisable for you not to try and take these pills if you don't have any issues. So that's it for this video, guys. If you enjoyed the video, please make sure that you give it a thumbs up. Make sure that you subscribe to this channel, like the video, comment there, and let's get to interact. That's it for this video. Goodbye, and see you on the next video.